let's do this creatine little launch because I'm really excited about this.
Yeah.
You ready for this?
I am.
Okay.
So I honestly, dude, when we did this video, I wanted to write KK and be like, we need to start a trend. It's like people having a fun way taking their creatine.
100%.
Do I have to flick it?
You can do whatever you want.
Yeah.
Okay.
There's no, this is all free.
We might do a couple because realistically we need all the ingredients.
Yeah, it's only, yeah. All right.
Okay. We're gonna, are you gonna, how are you gonna do it
I'm gonna
first?
do one of these.
Wow.
No,
Okay, I'm gonna try this.
I'm going right
Okay,
now.
ready?
Okay, ready?
3, 2, 1,
go. Oh no, it's Fred! Did you
got
get
it.
the first one?
Okay.
Okay.
I told you I'd get it.
I don't think you can, I don't think I can do it this way. Oh no, I gotta flick better. Okay, I'm just gonna toss.
Okay, third time's the charm. Okay, one more.
You nailed it the
One for
first
one.
time.
Oh, okay.
That was right in the face.
You guys gotta start slow, you know?
Okay, I'm gonna just throw it. One more.
I'm right here.
Yes.
Here we are. Okay. We are officially,
I was 1 for 1. I knew it.
you did so great. All right, we're officially locking in for episode 7. Are you ready
Oh,
on this?
that's so smart.
Episode 7 of the True Potential Podcast.
We're here.
We are here at Benchmark Proactive Health with Kaitlin Link.
Yeah, thank you
Dr.
so much for having
Kaitlin
me.
We're excited to chat with you.
Dude, that was the first clap that we've ever done.
We're trying new things.
Love
So
it.
we're really excited to chat with you. You and I kind of just met, like via, I knew about the company and then I sent a couple clients to you and then you gave me a really nice phone call.
Sit tall.
And we got to, thanks buddy. And we got to chat a little bit about just what you guys do here. So why don't you give us kind of the overview like you kind of gave to me and we'll kind of go from there.
Yeah, that sounds great. So Benchmark is a proactive healthcare facility, and we are trying to do things a little bit differently than mainstream healthcare. We're trying to close the gap. We want people to have a lot of information about their health, right? So we provide tests that matter. We provide information for people to understand what the tests are. And they are high leverage, they're modifiable, they matter. And so people come in and they can get a wide range of services, right? You can come in and you can get a DEXA scan. And the DEXA scan measures things like your visceral adipose tissue, super important metric, your lean mass, your total bone mineral density. And then when we go further from that, people can come in to get, you always come in person for a DEXA, but then you can come in person to do, physical testing. Like Dalton did his VO2 max, one of our, very good predictors of longevity. We also do strength and stability testing.
Nice.
And then depending on sort of what tier you decide to take, we want you to do blood pressure monitoring. Blood pressure is a really important metric. It's a silent killer. A lot of people don't know their blood pressure. We have people do a continuous glucose monitor, which is a great way of assessing somebody's metabolic health. We do blood work, and then we do wearable data. And the wearable data is for us to get an idea of like, how are you moving throughout the day? How are you sleeping throughout the day? And so we offer these different packages, but the idea is that we want people to have more information about their health. And the more information that people have, and the information has to be like relevant, important, modifiable, metrics that matter, but then to really understand them, right? And so we're trying to like close these gaps because like in the emergency department, I was sort of like going from room to room with like these similar stories, like just, kind of failing patients. Not that we didn't know how to treat the disease, but that we just weren't intervening early enough. And so, that's the whole idea about Benchmark is helping people have a better understanding of their health. So not only can they prevent disease, but they can live their best to reach their potential.
Totally. And I think like the proactive part is the most important. We're so reactive these days, I think, to everything.
Yeah.
So you're just giving people an opportunity to access these things that I don't believe are that accessible. Like I remember DEXA scans used to be few and far between the machine even being around, right? So
totally.
It's really, you guys have 2 here.
Yeah.
It's really neat that you can offer that.
Yeah, I think it's really, I think every Canadian should have a DEXA scan because I think some metrics are underappreciated.
Yeah.
Like muscle, for example, is so underappreciated in the healthcare system. Like for example, moving from emergency medicine to become this type of doctor, I retrained through the College of Physicians and Surgeons of Ontario, and I gave them a call. Hey, I want to be a preventive healthcare doctor. Like, we don't have that. Like, no, I know. So how do I become that? And so I created my own training program to become this type of doctor. And the organ that surprised me the most was muscle. Like, I cannot believe what I learned on this journey about muscle that I did not learn as a medical student, that I didn't learn as a resident, that I didn't learn as a staff physician.
And what were the big takeaways that you had? There's like
Okay, I've got lots.
Give us some
I'll
of
give
the
you
big
sort of like the top kind of five that I love to talk about. So first of all, muscle is your glucose sink, right?
Okay.
So in terms of like metabolic health, like managing your blood sugar, which is a massive part of our metabolic health, muscle is a huge contributor to that. So it is our, like I said, it's our sink. If we activate our muscle after, meals, muscle can take that load of blood sugar, keep our insulin nice and low, super important. Muscle is really important for our immune system. So muscle holds your amino acids. So our amino acids are our building blocks to protein, and we need it for everything. So let's say that you're facing a hospitalization, or you're like, have an illness. People who are adequately muscled and have a lot of amino acids are going to do better. So if I'm in the emergency department and I'm bringing in two people, same age, same sex, for pneumonia, for example, and one person is really well muscled and the other person maybe isn't, the person who has a lot of muscle is going to have a shorter admission. It's going to fight that infection better than somebody who is not. What muscle does for our cognition, right? So, we produce these myokines that cross the blood-brain barrier, and it strengthens our hippocampus, which is like this memory center. And then bone, right?
Yeah.
Like what muscle does for bone, one of the nicest side effects of building muscle is you're supporting the bone, right? So when we're resistance training, we're putting that mechanical load on the bone, and the bone says to the body, hey, I need calcium and phosphorus, and we maintain that density. I could keep going, but we'll end at that.
You get about it. I think it's important because I think that's all the rage right now, right? People are just constantly hearing protein and muscle mass and all these things, but knowing why and what it can do, because I don't think they know half of those. I didn't know a couple of those. Like, that's important for everybody to learn.
Like even heart health, right? So I think people are really like, oh, if I'm going to improve my cardiovascular system and my respiratory system, I have to do cardio.
Yeah.
And there's a lot of truth to that, right? Cardiorespiratory fitness will sort of tends to improve those systems a little bit better than resistance training. But in 2023, the American Heart Association released a paper saying that, hey, resistance training actually improves your VO2 max too. And it also improves your blood pressure, and it improves your cholesterol profile, especially your HDL. So anyway,
this is great though, but that's important because people feel like, I can't just strength train. It's not just like, there's so much benefit to it that way. The hard part is huge.
Yeah.
So talk to us a little bit about when you meet with people here and you're going through all these tests, what's the next step after that? So what's the long-term kind of approach? Do they stay with Benchmark for a long period of time? Do they see you again? Do you give them recommendations? Like, how does that work? Talk to me a little bit about that.
Yeah, the goal is that I get to see them, forever, right?
Yeah.
That this is a part of their kind of annual screening, or maybe biannual screening. So that is the idea, and that's the goal, that people come here and they start to get metrics, number one, that matter, but two, they understand them, and they understand how to modify them, and they understand that there's like all of these things that they can do in their lifestyle to improve these metrics. And then they come back and they retest, and then they see, that they've improved, or sometimes they haven't, but it's just this point in time that they get to sort of rejig what they're doing in the day-to-day basis. So that's the ideal. That's not always the case, right? Sometimes people come in and they're just like really interested in finding a little bit more about their body and where they're at, and they just, want this as a snapshot. But I would say for the most part, people are really committed to coming back and getting serial tests, like whatever that is, like a DEXA every 6 months, or a VO2, or blood work. And so it really depends, but for the most part, the plan is to track people and to support them. I think that's the biggest thing that people find when they come to Benchmark is that they have a team.
Yeah.
Like, I think healthcare system can feel lonely.
Yep.
And it can feel a little isolating. And it can feel like I have all this information, but I don't have somebody to help me like guide through it. And I think that's something Benchmark we really pride ourselves on is that we're a part of that person's team now.
Yeah.
Yeah.
Go ahead.
Yeah, like there's so much of this that fires me up because like obviously I'm in the healthcare space as well, and like I relate. Like when I got on the call with Nancy and we were chatting, I was like I was so fired up to hear about all the stuff you guys are doing, because like I think we align a lot on our perspectives. Like obviously you're coming from like the physician side of things, and what you guys do here, we're coming from like a rehab, strength, health phase, like with all our physios and stuff. But one of the things we really focus on at the movement and like our vision is to empower people to take control of their health. And I think that's something that like we as a society don't really look at as like we're in control of it. And I don't mean just like me going out and working out, but like you're saying, like the information, the data, the access to that stuff is so much more accessible now, which I actually think is a benefit to the individual. And then people like you and I like to pride ourselves in what we do at the movement is like people like us, where we are the educators of being able to have people understand what that data means and how to integrate it into their lives to drive things forward. I think that's a really big missing piece in healthcare, is like consulting and coaching people on how to actually make change. And data's great, but that doesn't mean anything if you can't understand the individual and apply the data and have them understand it, and also look at them as a human and be like, oh yeah, you know this data's off, but there's some things here we got to work on that will help you actually implement this into your life.
Totally. And this is like where this idea of like inputs versus outputs, right? So like your outputs are all of the data information that we're getting people, your blood work, your visceral adipose tissue, your lean mass, but what's driving those outputs? And this is like what's really missing in healthcare. Like, you know, we talk about lifestyle stuff, like, you know, in medical school, I didn't have any talks on sleep. I had no information on nutrition. I didn't understand the power of exercise. I did as an athlete. But when we can say to people, like, these are the major levers that you can pull day in and day out, and it doesn't have to be massive. They can be like these small changes that are going to drive better outputs. People are like, okay. And like when you see real time data, like people are like, okay, I got it. And then that's when we see change. And that's like when, I mean, there's nothing better than that. There's nothing better than when people are improving their health.
And good communication. From client to practitioner or clinician, because I watched a scenario go down here. Noah, guy's awesome, like really good communicator.
Shout out to Noah.
Yeah, really good communicator, great job. You know, you did your scan, right?
Yeah.
And you get data, which like is great. And then you're evaluating the data and you're looking at it, and you have knowledge in the space, right?
Yeah.
So you're looking at this stuff. And you ask him a question about a particular data point around bone density, and I could, because I'm getting to know you a little bit, I could see it go off in his brain a little bit, starting to think, oh, okay, and worry. And this is a guy that knows stuff, right? And Noah did such a good job of being like, hey, here's what we're looking at, here's what this means. You know, it doesn't mean that this is necessarily bad, just giving us an indication. He explained it to him very well, educated him, and I could see it put you at ease just by having a conversation, right?
Yes.
And I think that communication in the healthcare space and fostering an environment like this environment is welcoming, it's open, it's fun, it's comfortable. Like that creates good lines of communication for people, right? Like that matters way more than people think. And so it's all encompassing, but I think that that's really, really important. And it's like something that I really push like our team, and we've implemented this into our place, is like, you need to be good at that. Because people need you for those things. It's like, you know the data, but you need to be able to put someone at ease who might start to spiral on something that doesn't need to spiral on.
And even like, you know, when people come in, the first thing we say to them is like, what's interesting to you about the DEXA? And you will get such a varied response. Like, I just started a GLP-1 and I'm nervous about losing lean mass. Or, you know, I'm on this healthcare journey and I've just, you know, lost 20 pounds. Or, you know, my friend who is this age just, you know, had a health scare. And so finding out what that person, you know, why they're here, what are their goals, what are their values, like make decisions and everything's so much easier. Like, and that is like something we also really kind of believe in. You got to know your member, and if you know them really well, then it's another reason they feel so supported.
There's just so much emotion around health.
We
talked about that. You guys are basically speaking to that, and I think the problem is when people don't feel like they have any control over their health, they start to spiral, they start to do these things they don't understand, so there goes the control, right? So when you can explain it to them, when you can give them data points, when you can show progress, you made a great point with the GLP-1s, like, I don't think people are tracking enough of what's happening to the muscle mass when they're going on these things, and there's so much more available now. And it's just such a shift, but it's like knowing that I'm actually a little more in control, I'm taking my best step forward to do the right things when I'm on a medication or I'm doing something is super important. Because again, people rest a little easier and they're a little more motivated. Because at the end of the day, we are all in the service of this industry. The person has to do the action. We can't do it for them. So it's like we can be the cheerleader and the coach and all these things, but it's like if I can't get you to settle and understand the value and be kind of accountable and okay through the whole process, we probably won't get you as far as we want to. So it's super important. And you did a great job with that with me today with that, and Noah is fantastic with that through the VO2 as well. So
Yeah, like I say to my members, like you're the driver, like I'm the consultant.
yeah,
And so like kind of breaking down some of the barriers that we sometimes have in healthcare system, right? Like why, like the physician is the gatekeeper, for example. You know, like I've had people come to Benchmark who are in their 40s and, you know, have things on the DEXA scan that, you know, maybe like a high visceral adipose tissue. So I want blood work in that person. And they're saying, oh, my family doctor said I'm in my 40s, I don't need blood work. Like that's not, you know, that's like a gatekeeper role, right? So trying to break that down, giving people accessibility, giving people the opportunity to find out more about their body, and like metrics that really, like metrics that matter, that are modifiable and mean something.
Sorry, we talked about it with the continuous glucose monitor because you said, you know, a lot of people don't think that it's necessary for someone that isn't pre-diabetic or having issues
like
with
sugar
glucose.
dysregulation.
It's like, do you know how much information I just gained?
Yeah.
For the rest of my life?
Right.
So I can make better decisions, so I can understand what I'm eating and have a little bit of mindfulness.
Yes.
We talk about mindfulness and eating all the time, and I think it's funny, but it's like if I have knowledge, I can actually make more mindful decisions. And so that's what we're creating for people, and that's why, again, I'm getting fired up because I love this place in that sense that I'm just giving education to people, the right education, the right conversations, and I'm actually allowing people to take more control of their lives.
Yes.
Instead of them feel like helpless or trying to do it on social media, which is such a dangerous place to do it.
And the real-time data of the continuous glucose monitors like reinforces change, right? They're like, okay, I ate this, I see that, that means this. Okay, I am going to either do more of that or I'm going to do less of that.
Right.
Because we've given them the tool and we've given them the knowledge, and then we give them the support to make sure that they have, you know, the right tools to keep changing.
Yeah, because I think it can feel like bad or good.
Yeah.
You're good. You're being bad. You're doing bad and good things all the time. Like I know it's so simplified, but that's what people feel.
Yes.
Right?
And like taking the judgment out of this. Like this is your benchmark, right? This is we're getting a baseline, and like other things we say to a lot of people is like onward and upward, right? We're just going to start here, and where are we going?
Totally.
Yeah.
And I don't like because you're not going to actually make change if you go drastic. If you go all or nothing, it's going to people will rebel against that. They'll fall off of that. And I thought, you know, the best thing with the glucose monitor was just, am I going to have this beer tonight? And I didn't have an alcoholic beer. We talked about that, but I still was like, oh, I shouldn't have it because I have the glucose monitor on. It's like, it's all right. This is what I want to see. I want to see how this changes things and affects things.
Right. We tell people be really curious.
Right. Yeah.
Do all of the things.
Chocolate.
Yeah, like the continuous
all the things.
Yeah, the continuous glucose monitor is not a diagnostic tool for us at Benchmark, right? It's like an opportunity for people just to learn more about themselves.
Yeah.
So I'm like, during this 10 days, be as curious as possible. Not only about the food you're eating, but like be curious about a stressful event. Like we have a lot of times people are like, you know, I'll be watching their continuous glucose monitor and there's like, you know, big spikes, and that was like a stressful meeting.
Right.
Or that was like, you know, somebody got cut off in traffic. But also what poor sleep does with our sugar control. Like people tying in sleep is such a big part of what we do here at Benchmark too, because sleep is undervalued in my opinion. And when people see that a poor night's sleep causes their blood sugar to go up, that's more motivation for them to go to bed earlier and to, you know, have a longer sleep, which is going to be so beneficial for a whole bunch of different reasons. Yeah,
I have a couple of thoughts because like I feel like you might be able to speak to this a little bit. It's like we're at an interesting time in healthcare, I think, where like we're seeing this evolution of like whatever the next tier of whatever you want to call it is happening. And like I think you're sitting on the forefront of that. I like to think that how we operate at the movement, we sit on the forefront of that. And there's challenges that come with that due to like the system and the way the system is set up and how it integrates with what maybe you're doing and how you're approaching it. And even how we educate the consumer on what they're investing in, because I know probably when they come in here, they're investing in themselves in a different way than they would if they're going to another healthcare practitioner. And I think like that's always like a conversation piece that gets thrown in it. And I think a big part of what I've learned from trying to be on the forefront and maybe changing the way that we have people purchase it, like our services and how it's priced and all of those things in terms of the value that they're getting, and why I think these conversations are really important. And shout out Nancy for putting you on all these things, because I think we need your face, you explaining these things so people can relate to them, because people need to know the value in what they're investing in. And it's all of of what we're talking about here. It's all of what we did on the behind the scenes video. It's the education. It's not just the one-to-one transaction of you come in, I give you your blood work, you walk out.
Yes.
There's so much more value that these people are investing in, and it's like what I've been really keeps me up at night is how do I continue to educate the consumer on what they're investing in. They're not investing from a physio standpoint in reducing their pain.
Yeah.
They're investing in me to help guide them to get back to what they want to pursue and is meaningful to them.
Yeah.
Which is we're going to do that by evaluating you. We're going to identify your problem. We're going to provide you with a plan. We're going to progress that. That's going to include education, probably at the front of it, and then exercise and how we implement that into your life and how are you more healthy. Because if we're doing those things, your injuries in your body are probably adapting and getting better. And it's like we use different things to keep people accountable. It's like that's what you're investing in.
Yes.
And it's such I want to say a challenge is not a challenge. It's just a different thing. And I think it's so important that we continue to educate consumers on like where their dollar can go and the value they're getting versus like, oh, I'm going to go in and this doesn't cost me anything.
Yeah. Yeah.
You
and
know?
I think, we talk about this all the time, right? And so we talk about this with our pricing. So trying to make this as accessible as possible. Nancy and I spend a lot of time thinking about how we can drive our cost down so that our consumer has a lower cost. Because in the environment we're in, people are not used to paying for certain healthcare services, right? And so, it just takes one visit.
Totally.
And then people are sort of, okay, this makes a lot of sense. I think the one thing that people really appreciate is like typically no news is good news. Like in a typical healthcare environment, like you get a test, you're like, well, the doctor didn't call me, so let's hope it's okay. And that just would never happen at Benchmark, right?
Yeah.
Like we have this beautiful dashboard. We are launching an app, and that is so that people have their health data at their fingertips. But that every single metric in there has been explained, right? It's been explained through one of the providers at Benchmark, and then it's also explained on the dashboard. You've got your definitions, your strategies, not only where normal is, where's optimal. And so we have spent a ton of time, improving that aspect. And so that I think is the value.
Yes.
In addition to a whole bunch of other things.
Of course.
But that is the value that's a clear difference from what a typical healthcare experience would be like.
It's funny you say that because it is so true. You don't want the news. Like if you don't get a phone call, that's how you feel. But it's like that still leaves you with such a gap of understanding what just happened.
It's also a very...
I totally forgot that that's how that goes.
Yeah, it's also like very trusting, right? It's very trusting that physicians are humans, right? And so there's mistakes that can be made, and so I think closing that gap. This is what this test showed. It's also like I think one thing that we spend a lot of time talking about is like normal versus how do we improve things, like how I don't love the word optimal, but like if you got blood work with your family doctor, it's sort of like, okay, is everything within normal range, right? So we see a lot of people who have a hemoglobin A1C of 6.0 is considered prediabetes. At 6.5% is considered diabetes. And I have a lot of people who have been sitting at 5.9 for 10 years. And I'm like, okay, you know what? This is a real opportunity to take a look at this and to bring you, like I look at it, this window of opportunity, right? If disease sits here and health sits here, all these people in this window, right? And so with a little bit of guidance and education and, how can you improve this in your lifestyle and the importance of it, people come back into health, right? We want them to go this way, not that way.
Totally.
And so, I feel like when people start to see that is the intention that we have here, the value is clear. But I think the point I always try to make too is like accessibility is so important to us.
I just think about again, I go to emotional response, but like sitting at 5.9, it's almost like I want to avoid that number if that's where I'm at. I'm so close and I just want the doctor to say, okay, I'm at 5.9, it's still good, I'm still good, as opposed to how do I get better? How do I just frequently have this conversation so that I can keep improving it? How do I keep checking in? Like the fact that you can have access to your dashboard all the time is... to me, I didn't even think about it that way because I just got blood work done recently and it's on a piece of paper that I got printed off and I'm going to lose that paper. If I could just pull up everything and constantly be checking in, and then in 6 months I come see you again and we go, look what's changed, and like this is the trajectory now, and like here's some more advice that I can give you because now I have more data, and so you get better every single time, or everybody here gets better. I just think like it's like having a mechanic for your car. Like that's what this service is, right?
Yeah,
I'm
and
checking in.
The trends are so powerful. Like I feel like, you know, speaking about value, like if somebody comes back for a second visit, I'm like, that's like, it's sort of like a hook, right? Because we're just like, they're like, okay, like now I can see my trend, and now I'm, you know, it doesn't always have to be like, oh, I'm improving, right?
Yeah.
Sometimes people are like, oh wow, that lifestyle change led to things that actually didn't improve things. But then we have this ability to course correct.
Right.
And if we're not getting these measurements, we can't course correct, because majority of Canadians are flying blind, right? We don't have a roadmap. We are on a dark road without lights, without street signs.
And that's the biggest problem, because we lose sight of the human aspect of this. And like when we look at humans, it's like you break it down from like a psychology standpoint. It's like humans want to be supported.
Yes.
Right? And that's what we're trying to offer them here. They want autonomy. As much as like people pretend like they don't want autonomy, or maybe not pretend, but not realize that they want the autonomy of the information until they get it. And then once you have autonomy, you can become, what's the word I'm looking for? You can like build up some type of competency in those areas.
Yeah.
And then once you build competency, you can transcend to the next level, where like now you have this information, and that's like that next extra level that you get to. But if it doesn't start with the support and people feeling safe in the environment, and then having the autonomy, and then building the skills, they're never going to get to that next level. And I think like we've just gotten brought up to not have the autonomy, because we're not capable of managing our own data. And I think that shift is happening a lot, which I'm really happy about. Like the decentralization of that is really, really good. What that puts more onus on, which I'm a fan of, is us as healthcare practitioners and the individual. Also a really good thing. You need to have ownership over that as a person. You need to have ownership over it. And your healthcare provider should be helping you take ownership over that. And that relationship is a beautiful thing if we can get there. It's just not really the thing, right? It's just not the thing yet.
Yeah.
And I get really fired up about this, because I believe that this is where things are going. And I think people like you and people like you and people like us, and there's other people that are obviously doing this, is like if we do it enough, it's going to change the system. It's going to shift, because people are going to be like, well, what's going on at Benchmark? Like, why are they doing so well? Why are their clients thriving? It's like, if the consumers are going in there and like showing other people like, hey, this is worth investing in, all the other people that control necessarily how you get reimbursed for healthcare, all that stuff, is going to have to shift at some point.
Yeah.
And who knows when that is, 5, 10, 20 years. And ultimately, to me, it doesn't matter. I'm going to keep doing what I'm doing. But I think that's like such a big thing that like I wish more people would think about, and more healthcare practitioners would get in the forefront of educating people on.
Yeah. Okay, there's so many things you said there that I want to unpack. So the first one I want to talk about is like the nervous system state of like, I worked in Emerge for 10 years, right? So somebody's in a sympathetic nervous system all the time, right? Like people, it's like just such a fight or flight. But here I have the opportunity of like getting people when they're not in that. And so people walk through the door like, hi, I'm Kaitlin, eye contact, how are you? Like, why are you here? Like, tell me about yourself. That experience right off the bat is someone's like, okay, all right. Like you can see that their shoulders drop and you can see that they're like, okay, like this is, because I think sometimes healthcare can make somebody feel like not a person, right? Like it can make people feel like, okay, we're just getting tests on, and it can be really isolating.
It's also vulnerable.
It's vulnerable. Like, and so I think that one thing you said there was like, I just had to say that that's something so important. It's been so important in my whole practice is like identifying the human. And like every single visit in the Emerge, I would always try and find something to talk about outside of that visit. Oh, hey, look at that book you're reading. Or like, oh, like your shirt says this, where are you from? Or, oh, like, do you have grandkids? Like whatever it is, so that that person's like, okay, like I'm a human being, I'm here. And it's just like takes the tone, weight. And that is when you can start to get into things like goal setting. So when you were saying accountability, and like, you know, if you understand the person and you understand where they're coming from, then creating goals is easy, right? And so, and that's when somebody, you can see it, you can see the shift. Someone's like, okay, this is on me. Like, Kaitlin's telling me I need to do 3 strength training sessions a week because I need my lean mass to go up because of all of the reasons we educated them, glucose control, amino, you know, all of the stuff. Then they're like, okay, wow, this is like my job. And so now we have this app where we create the goals for them. They have the ability to create goals for themselves. And now this app is like, hey, Mike, where are you at with your strength training? So it'll show, okay, 60% complete, or are you getting your 7 hours of sleep at night? And so this is where like the accountability with data and like the app and the dashboard become like, it's like a secret sauce. It's like, it works. People are starting to change. They feel the change. They feel better. They have more energy. And then what I know is happening is that the risk of disease is going down, right? So people are reaching, people in their 40s sometimes like say to me like, well, I'm just like in my 40s, like I'm supposed to have low energy. I'm supposed to not.
Yeah.
And it's like, not the case.
Yeah.
And they start to have that shift.
Well, I'm 30 now. I got pain. I got this.
Yes.
I hear the same sense.
Yeah, and so like there was a lot to unpack that you said there, right? And so I think that the empowering people to take control of their health is, I could say it 50 times, right? Because it feels so good for everybody, right? It feels so good for the provider. It feels so good for the person. And then when that person starts to see the shift in their healthcare or whatever they're looking to do, their energy, their focus, their performance, it's just like, it's great.
It's a beautiful thing.
It's a beautiful thing.
Yeah.
Yeah, and it's like it's so rewarding. It's the emergency department is very rewarding for so many reasons. Like obviously, right, like saving people's lives and helping people on like sort of their worst days, but it's comparable to what we do here.
Yeah.
Maybe even more so because I get to follow people and I get to see the change. In the emergency department, I wouldn't get to see them again.
Yeah.
True.
And so for me as a physician, it's just like so satisfying. I do it for free.
Yeah.
Yeah.
I want to ask you, because I don't want to miss out on this, because like, one, you can tell if this is something that's very meaningful to you, very
Yes,
passionate,
so
right? Which is great. We talked a little bit, we didn't talk about it at the beginning, but I'd love to hear maybe a little bit more about like, why is this something that you're so passionate about?
Yeah.
Where did this come from? Benchmark is now what it is today, but obviously it wasn't like that before. Like, how do we get necessarily here? Like, what's that little story?
We also got to slide Nancy in there somewhere
Yes.
because we keep hearing about
Yo, shout out
Nancy all the time.
That's why I wanted to bring this
Yeah.
up. I'm like, can't leave Nancy out.
Okay, so I'm gonna give you I'll give you the short story, right? The short story is like Benchmark came out of like room to room in the emergency department, constantly feeling like, do we have to be here? Like if I had intervened 5 years before, could we have prevented this heart attack, this stroke, And so that's the short story. It's just like in the emerge day after day, just feeling like this, like really this calling to not wait anymore, like to get out and to start educating people about what we could be doing in our lifestyle to prevent these catastrophic outcomes. It takes one day of being sick, like a virus, a flu, whatever. One day of sick and you're like, I'll do anything. Like I'll do anything to feel better. Like I think we all can kind of like resonate with that. The longer story is this sort of probably started when I was 5 and Nancy was 4. And
Oh, so we're going
way back. And
Whoa.
I won't make it so long.
I love it.
But Nancy and I have been friends our entire life, and she is such a meaningful person in my life. And so yeah, we met when we were very little. We lived 3 houses down. Sometimes we went to the same school, sometimes we didn't. Always just driving each other to our absolute potential, like every single test. Helping each other understand, helping each other study, always wanting the other person to do their absolute best. Nancy's a runner, I'm a tennis player. We both went down to the States. I played tennis at Rutgers, Nancy ran at Dartmouth. Nancy ends up staying in the US to do all of the cool things that she does. Like she worked for Sesame Street as a consultant, PayPal, Upwork. She went to Berkeley Business School. She married her husband, Scott. She has 3 beautiful girls. And she has been in the startup world. So that's sort of like the longer part, but Benchmark was derived out of actually a talk that I gave. So I think it was in COVID where I was like, I got to go out and start educating people about prevention, about the importance of exercise, the importance of nutrition and sleep. Like I'm going to do more, right? So I was learning about it all the time. I grew up as an athlete, and you guys probably recognize this. Like in university, I was like, wow, I have so much amazing attention. Like I have someone watching my food, and a strength trainer. I have access to a sports psychologist. Like I wish everybody had that, because you really start to learn and understand your own body, and you start to like realize what it feels like to be physically trained. Anyway, and so when I was in Emerge, I started giving talks. And so this one particular talk, I had a little bit of pressure around. And so I was like, okay, how am I going to make this talk so good? And so what I decided to do was have my husband, who's a very analytical, super fit guy, and he's really up for kind of anything. I was like, I'm going to put you through a whole bunch of different things, and I'm not sure where this is going to go, but if this actually is like a good something that's going to be used as a case study, and I'm going to present this to this talk where I wanted to do really well. So he's like, sure. So I bought him a Whoop, which is a wearable. I made him get a DEXA scan, VO2 max, blood work, continuous glucose monitor. And like I said, he's very analytical, and he's kind of like, gets to the heart of things really quickly. And he was just like, this is working. He's like, I'm going to bed earlier. I don't want to drink alcohol anymore. Yeah, I'm going on runs. I'm doing more strength stuff. He's like, something's working here. So I took all of his data and I presented to this group of people. And in the presentation, people were like, can you do this for me? And I was like, and that was where sort of the idea came about.
Yeah, that's good.
And then so I said to my husband, yeah, listen to what happened. And he was like, go, just go. So I bought 10 Whoops. I got my like friends and my family who I knew would just be up for it. And I was like, listen, would you guys be willing to do this pilot? That's what we called it, the pilot. So I ran a few pilots on my own. And then I got to a point where I was just like, okay, I can't expand this any further. I don't have the skills. And so Nancy just happened to be in this perfect part of her career where she had a break in her startups. And she's like, yeah, I'm going to help you. Like, I don't know like how long or like where this is going to go, but like, I'll help you. And so she started to help me, and then she was like, she was great. She has experience. She was like, let's just see where this goes. I'm not totally sure where this is going, but let's just see how it goes. And because we've worked together so closely with like studying and athletics and like pushing each other, and we also just have known each other our whole lives, like there was a combination of trust, a combination of like wanting to work hard for each other. It just works. And so now Nancy manages all of like the other aspects, which is massive, like the dashboard, the app, the scheduling, the hiring, the paying, like all of it. She does all of it. But she's also the one that has like the vision. She's like sitting back and she's like, this is like where I think we can go.
Yeah, she's sitting up in the mountains when I was FaceTiming her, just like taking it all in, just like I could see it.
Yes.
Makes sense.
And it's like she's just the best partner to have, and she and I have different skills, right? We just have different skills, and that's like what makes a partnership, as you guys know, like so valuable.
You want to say
I'm gonna tear up, bro. I'm thinking of you.
I thought you were gonna talk smack about me.
Yeah.
No, and not to diverge because it's a beautiful story, but it's the truth. In any partnership, or like you need support, but you need different skills. And I think it goes back to what you're saying when you work with clients too.
Yeah.
Like you need to be there for them through things, and when you are with people, you build a trust.
Yes.
And then you can actually get a lot further with people, right?
Yeah.
And so that's what you're building here, it sounds like, with all the clients that you have. It sounds like you come from that naturally with your friendship and who you guys are as owners. And yeah, it's incredible. I really love that, to be honest.
I know, I feel like this story is so interesting because it's just like very meaningful to me. We actually had like a little bracelet stand when we were like 10 and
Really?
Yeah, we actually did this like whole summer of
First
like
wearable ever.
Yeah. So funny. It's so funny. Anyway,
Just like you track your
we were meant to be business owners together. Anyway, so that's like sort of a very longer story of how Benchmark came into like where it is now. And just like very proud of the ability to work with people and help them change their health trajectory.
Yeah, I can tell that.
Yeah, love it.
Okay, two things.
Yeah,
I think we see if there's anything else you want to say about Benchmark that we didn't hit on.
Okay.
And then you drop the question on her.
Oh, the official?
And then we wrap this up.
The official question. Okay, sounds good.
So is there anything else that you feel like you want to get across or that you didn't mention that's important?
I think it probably came across, but I just think it's important to highlight is the community that we're trying to build. I think community is so important, just in another way for people to feel supported just outside of, the people who work at Benchmark. So, creating our newsletter, like we're starting to do like office hours. We want to start to do like events here.
Which are all great, by the way. The newsletter was great. I've been reading it. I didn't do office hours, but the fact that you have that is also awesome.
Yeah. And so I think that is something that Nancy and I spend a lot of time talking about, like how do we support our members, like within the actual part of Benchmark, the tests but also like how do we build this community where people can get motivated and excited and be a part of something bigger.
Yeah,
I think we talk about community a lot. Like, I think people just want to be a part of something, be able to kind of see the people they work with consistently, and that's just not accessible.
And know you're just not alone.
Yeah.
I know everyone's on their own pursuit.
I think that's why, that's why run clubs are big. That's why like group fitness is big. Like, I think the more you can connect with people, and even have like, so you're gonna have events here potentially at this location.
Yeah,
That'd be
like
cool.
we're thinking about a whole bunch of different ways of just starting to engage people so that like they can be like, I'm a benchmarker.
Yeah,
right?
we can all do grip
Ooh,
strength tests
benchmarker.
together and like challenge each other
Totally.
Do you want to tell them
about how your grip strength's better than mine.
how I dominated you?
Do you want to
You
tell
might have
them?
to go check the YouTube video out.
I'm more concerned that I'm asymmetric. I need to like really work
And
on
I
this
was
left
symmetrical.
hand. Yeah, you were. I was not. Brutal. Absolutely brutal. All right. So one of the questions that we ask all of our guests is, what does true potential mean to you when you think of that term?
I wish you'd told me this before. Okay, so I actually know this because I think potential is such a powerful word. But I like to start with like your own, and this is gonna sound cheesy, but like your own benchmark. Like where are you really understanding your own body, your own goals, your own capabilities, and doing things that are within your reach, right? So I think like small changes make massive impacts. So I think sometimes people think, okay, where's my potential? Like I have to like do all of these like crazy things to get to this like massive potential, but like we can reach little bits of potential every day. And so like really defining like what your own goals are, understanding your own situation, and trying to reach these like small attainable goals every day will help you get to wherever you want to go.
Yeah, I agree with that. I think we're all victims of the comparison.
Yeah.
This person's already here. I'm so far away from that. It's like,
Yes.
yeah, keep building and see what
Keep
happens over
building.
years. And when we see you in a year, right, we retest and we do all this stuff.
Compounds.
Yeah,
Absolutely.
and just like really being like, you know, we tell people all the time, this is your benchmark, this is yours.
Yeah.
Right? This is where you are, and to build on what you are now is super powerful. So like to take out the comparison and yeah, because I think potential is like a beautiful word. I love it.
Thank you. Well, I'm happy that we have it as the podcast title.
Yeah.
Yeah, embrace your starting point. Embrace
it. Yes. Yeah. I think there's so many important points there. Yeah.
Love
Thank
it.
you so much,
This
guys.
has been awesome.
This
We
is
hit a
great.
lot of points.
Yeah, this was awesome. I think to wrap it up, one, check out Benchmark, check out the website, Instagram, all that
Yeah.
fun stuff.
Sign
If
up for a
you're in
newsletter.
If you're in Burlington,
Yes.
sign up for the newsletter. If you're in Burlington, Hamilton area, come check it out. It's a
Yeah.
beautiful space. You might sweat a little bit in here. I sweat a lot today.
Yeah, we talk about your VO2.
you might
Check
show-
out the behind the scenes
That's
for
what I was
Dalton's
just about to
VO2.
plug. Check out
There
the
we go.
behind
Plug
the
it up.
scenes, watch me do a little grip strength, beat Connor, beat Matt.
Man.
Have a good VO2 score, all that kind of
Yeah, it's
stuff.
just that over there.
All right, that's it.
Thank you so much, Kaitlin.
Okay, thank
Appreciate
you
you coming
guys.
on.
Yeah, that's great.
See you guys.